The broadcast is now starting. All attendees are in listen-only mode.
Hello and welcome to the Thyroid webinar. Our webinar today is on cold lasers for medical conditions. So let's begin. There's been a lot of anecdotal information on using cold lasers for various medical conditions, but what we're seeing increasingly over the last number of years are fairly good clinical studies on the use of laser therapy for some various medical conditions. Today we're going to look at some of these areas, and these will include thyroiditis, lymphedema, cystitis, bronchial asthma, and prostatitis. So let's start with the thyroid. First, let's look at some of the laser effects on thyroid, and also why will we be talking about laser and thyroid. So just some background, if you're using laser now, you'll know that one of the contraindications, one of the things we tell you not to do, is don't use the laser over the thyroid. So here we are, and it'll look like contradictory information. However, if we look at the reasons for not using the laser for thyroid, the reason or rationale is that the laser can increase or proliferate the thyroid hormones, and we're a little worried about that, about having an effect on the hormone levels. And that's why we always say, well, don't use the laser over the thyroid. But the question that often comes up is, well, how about patients who have a decreased thyroid hormone level? Could this be a benefit to them? So studies that we've seen lately are looking at this and the potential benefits of using laser to actually treat thyroid conditions. At this time, we wouldn't recommend it for the thyroid users or out in the field, because you really would need to closely monitor the thyroid hormone levels. But it's an area we really see, it's an emerging area, and down the road we can see uses for the laser in this area. So why would we consider using laser on thyroid? First is regeneration of thyroid tissue. In some conditions, in some thyroid conditions, we have a destruction of the thyroid tissue. So we're going to look at biostimulation or regeneration of the tissue. We can also improve the circulation to the thyroid. We can also decrease inflammation, so there are anti-inflammatory effects. And finally, we can help to increase the T3 and T4, or the thyroid hormone levels, using the laser. So these are all possible benefits of using laser over the thyroid gland. Here's a study looking at the evaluation of low-intensity laser effects on the thyroid gland of mice. So in this study, what they're looking at was an assessment of whether the laser can change thyroid hormone levels. They're going to assess the thyroid hormone levels after treating with the laser. They used 65 mice and assigned them to 5 different groups. Each group was treated 3 times with laser. They used an infrared diode laser, 780 nanometer wavelength, and 4 joules per centimeter squared energy density. So fairly low dose. And then they collected blood to check the thyroid hormone level at different times. They collected it 24-hour, 48-hour, 72-hour, and 1 week after the treatments. This collected material was analyzed for the T3 and T4 hormone levels. And what they found was that there was a statistically significant hormone level alteration between the first day and 7 days after the last treatment. And the authors concluded that low-level laser therapy of the thyroid gland may affect the level of thyroidal hormones. Now, there are many studies that have supported this, that we can have an effect on thyroid hormones, and in the past this has become a precaution in that most laser companies will tell you, well, don't treat over the thyroid because we might affect the thyroid hormone levels. But the inverse of this is that there may be some benefits to laser therapy over the thyroid if there's a reduced hormone level in this patient, like a hypothyroid situation. In this next study, we looked at the low-level laser therapy in chronic autoimmune thyroiditis. It was a pilot study out of Brazil. Fairly recent study. It was published in 2010. Good study, double-blind, randomized, placebo-controlled study. So that's the type of study we want to see with laser and generally. The author's objective was to gauge the value of applying low-level laser therapy in chronic autoimmune thyroiditis patients. And they used ultrasound, and they looked at thyroid antibodies and thyroid function after treatments. So just a little background on thyroiditis. Thyroiditis, most types are caused by an attack on the thyroid that results in inflammation and damage to the thyroid or thyroid cells. It can be an immune condition, a problem with the immune system. It also might be an autoimmune condition where certain people make thyroid antibodies that are attacking their own body or their own thyroid gland. It acts as, the body thinks the thyroid gland is a foreign tissue. There are other causes of thyroiditis too, infection, both viral or bacterial, which can also result in inflammation of the glands. We can see different symptoms. We can actually see hypothyroidism or hyperthyroidism. Here we've got a picture on the side of Hashimoto's thyroiditis, which is a hypothyroid condition, or Graves' disease, which is a hyperthyroid condition. So in this study, going back to this study, they took 15 patients with hypothyroidism that was caused by chronic thyroiditis. And these patients had been receiving a synthetic thyroid treatment or levothyroxine, and they were selected for the study. These patients received 10 applications of laser therapy at 830 nanometer wavelength, 50 milliwatts in continuous mode twice a week. They used either an acupuncture technique or a sweep technique, so there's different techniques for using the particular laser they were using. And then they did ultrasounds following the treatments, before the treatment and also 30 days after the laser therapy. And then they discontinued the synthetic hormone treatment in these patients. They wanted to see what would happen naturally to their hormones. And finally, they looked at the different hormone levels, the T3 and T4 hormone levels. They also looked at antibody levels, which are sometimes evidence of tissue destruction. So they wanted to see if there was continuous tissue destruction. And this was a long-term study. They looked at these levels 1, 2, 3, 6, and 9 months after they had taken away the synthetic hormone treatment. So their results were that all patients in this study were able to reduce their synthetic hormone replacement dosage. So that's good news for the patients. That's what they want. They want to come off their medications and their supplements. Including 7 or 47% who didn't require any of the synthetic hormone throughout until the 9-month follow-up. The LT4 dosage used pre-laser therapy decreased in the 9-month follow-up. Also, the antibody levels also decreased, and as I mentioned, those are signs of destruction of the thyroid gland, so the thyroid gland was starting to heal. Their conclusion was the preliminary results indicate that laser therapy promotes improvement of thyroid function as patients experienced a decreased need for LT4, a reduction in their antibody levels, and an increase in parenchymal echogenicity, which is the ultrasound finding. So generally they found the thyroid cells were regenerating, the thyroid tissue was regenerating, and the hormone levels were coming back to normal after using the laser on a hypothyroid situation. So we're going to move on to lymphedema now. Now, lymphedema is a condition where we would recommend that you can use Theralase or your laser, whatever laser you're using. There's enough evidence out there. It's actually a very, very good application for the laser. So what are some of the laser effects on lymph vessels? The laser can cause dilation of the lymph vessels, regeneration of the lymph vessels. So if the lymph vessels have been damaged, we want to regenerate the vessels so we can kind of pump out the fluid. And this regeneration can happen faster, better, because the vessels will return to their original shape rather than a network of small vessels. Will have vessels that should be their regular size, and with reduced permeability, so they're not letting all that fluid out. Instead, they're getting rid of all that extra fluid buildup. And here on your left, there's a picture showing kind of a classic case of lymphedema here with that swollen, one side swollen. So what do we do with our Theralase treatment? Generally, we treat proximal to distal. A typical setting would be 45 milliwatts, a couple minutes per point. So you're not going to treat one point. You'll start up probably closer to the axilla if you're treating an arm lymphedema, and then move on your way down, covering various locations along the lymph vessels. You'll use your multiple probe or your cluster probe. How many treatments? Well, that really depends. You'll have to monitor the patient. As far as I understand, this is quite long-term treatments. You might be treating several weeks or several months, monitoring the progress as you go along. Here I'm going to review a couple studies. They're very recent studies. I believe both of them are out of 2010. And they both look at post-breast cancer lymphedema. So this first one is called The Short-Term Effects of Low-Level Laser Therapy in the Management of Breast Cancer-Related Lymphedema. This is out of Pittsburgh, 2010 study. So here they took 17 breast cancer-related lymphedema patients that had been referred to a lymphedema program between 2007 and 2009. All these patients had had other treatment. So this was not their first treatment, such as different types of physical therapy, manual lymphatic drainage, or pneumatic pump therapy. And then the researchers added in laser therapy to their therapeutic regimen. And all the patients completed 2 cycles of laser therapy, so they had one set of treatments, took a break, and did another set of treatments. One of the ways they measured the effects of the laser is they take a delta C score, which is the difference between the sums of, they take the circumference of both arms and check the difference, so the good arm and the swollen arm. They looked at the pain score, scar mobility, range of motion, and this is what they found. They found that the delta C, or the difference between the arms, decreased by 54% and 73%, so 54% after the first cycle, and after the second cycle of laser therapy, it had decreased by 73%. So the arm circumference was coming down. There was a decrease in pain with motion. The scar mobility increased, and the shoulder range of motion improved. So there were a lot of general improvements in the laser-treated groups. Their conclusion was that patients with breast cancer-related lymphedema received additional benefits from laser therapy when used together with standard lymphedema treatment. And the benefits included reduction in limb circumference, pain, increased range of motion, and scar mobility. They found 2 cycles of laser therapy were better than just 1 cycle. So I'm sure many of you are thinking, how can we treat these patients? They've had breast cancer, and cancer is a contraindication, and that's correct. We would not proceed with treatment if the patient had just been diagnosed with cancer, if it was right after their treatment, whether it be radiation or chemo. We really want to wait till a point that they're in remission from their cancer. So we want to have the go-ahead by their oncologist that they're in remission. And if at that point they're still suffering from the lymphedema, then we will treat that, because as you know, there is a risk using laser to increase the cancer cell growth rate. We don't want to go in that direction. So make sure that they are free and in remission from cancer before you're going to do any kind of treatment. Also, of course, we have to make sure that it's within our scope of practice to be treating them. So depends on the practitioner. Some practitioners can treat lymphedema, and for some, this is just not in their scope of practice. So here's another study, the efficacy of pneumatic compression and low-level laser therapy in the treatment of postmastectomy lymphedema, a randomized controlled trial. This study is out of Turkey. It's a 2009 study. The author's objective was to compare the long-term efficacy of pneumatic compression and low-level laser therapies in the management of postmastectomy lymphedema. So here they took 47 patients with postmastectomy lymphedema, and the patients were randomly assigned to either a pneumatic compression group or a low-level laser therapy group for 4 weeks. The first group had 2 hours of compression therapy plus limb exercises on a daily basis, and Group 2 had 20 minutes of laser therapy and daily limb exercises as well. The outcome measures were the delta C, so once again they used delta C, which is the difference between the sum of circumferences of the affected and unaffected limbs. They used a visual analog scale and grip strength. So here are the results. They also found that delta C decreased significantly at 1, 3, and 6 months in both groups, so they did a long-term follow-up here. At 12 months, and this is interesting, there was only a significant difference in delta C in the laser-treated group. In Group 1, the pneumatic compression group, they did see results, but they weren't long-term results. They were more of a short-term result. The laser-treated group had good results, significant results, and they were fairly long-term, even after a year. Pain was significantly reduced in only the laser-treated group. Same thing, pain was significantly reduced in Group 1 only at the post-treatment evaluation. So Group 1 was the pneumatic compression group, where in Group 2, which is the laser-treated group, there was more of a long-term decrease in pain. And grip strength was improved in both groups without much difference between them. So in this study, we're really looking at a decrease in limb circumference and decrease in pain, which were both on a long-term basis much more significant in the laser-treated group. The conclusions of the authors: patients in both groups improved after the interventions, but Group 2 had better long-term results than Group 1. Low-level laser might be a useful modality in the treatment of postmastectomy lymphedema. Now we're going to move on to hemorrhoids and cystitis, which is a painful bladder system. I've come across a lot of anecdotal information on treatment of these areas, and obviously when I say anecdotal information, these were successful treatments. However, it's still kind of hard to find good studies in these areas, but I have heard quite a few success stories generally. Now, hemorrhoids are actually normal structures, they're normal vascular structures in the anal canal, but they become pathological when they're swollen or inflamed. So if we're looking at treating them with a laser, we're really treating these swollen, inflamed vascular structures. How can laser therapy help? Well, laser therapy might reduce symptoms by relaxing the pelvic floor musculature. Generally with pelvic floor pain, any kind of pelvic floor pain, we're looking at a tensing of that musculature. And once we can relax that musculature, it generally helps lots of different conditions that involve the pelvic floor. So we want to reduce these, relax these muscles. The second effect from laser therapy will be the anti-inflammatory effects, and that of course will help hemorrhoids, and anti-pain effects. So what would we recommend for Thyroid treatments? Here we're looking at using 40 milliwatts, 2 minutes per point, probably using your triple probe. So if it's an external hemorrhoid, we can use our triple probe right over that hemorrhoid. If it's an internal hemorrhoid, we're really kind of just trying to irradiate that area, but we're working obviously externally. It's a little harder to get the light in there, but it will still have effects. The external hemorrhoids will be easier to treat. For pelvic floor pain generally, we're looking at about 50 milliwatts, 2 minutes per point using the multiple probe. And what we're really looking at here is relaxing the pelvic floor musculature. Once again, this is not for all practitioners. It really has to be within your scope of practice to be performing these procedures. Here's a study that looked at Heaney laser treatments of hemorrhoids. And in the study's abstract, it said that in the treatment of first and second degree hemorrhoids, the Heaney laser was an effective, simple clinical procedure and a good alternative to medical therapy or surgery. In this study, the researchers used a red light 632.8 nanometer, and they treated about every 5 days for a total of 6 treatments. The author's conclusions were that treatment was effective in pain alleviation from the first session, and final results were excellent, as shown by their table of statistics, which unfortunately I don't have. The effects produced on the rectum mucus were discussed in this study, and the authors tried to come up with an explanation of how the laser really helped these patients. Here, what I've given you was the journal and all the details in terms of finding this study, but this is all I could find. But regardless, they found good results using a Heaney laser, which is a much low dose and low powered laser compared to the Theralase. So we would, and as we've seen from some of the anecdotal information, the Theralase actually does work quite well for something like hemorrhoids and hemorrhoid pain. In fact, we've spoken specifically with some clinics that deal only with pelvic pain, and they're using the Theralase as a standard part of their treatment programs. This next study is called Urethral Pain Syndrome and its Management. Urethral pain syndrome can be an occurrence of persistent or recurrent urethral pain. Usually it's on voiding during the day or night in the absence of any kind of proven infection. Once again, infection would be a contraindication in any of these conditions. If your patient has a bacterial infection, we wouldn't be able to treat them. They would have to go on some kind of antibiotic first. Other terms that are used for urethral pain syndrome are painful bladder syndrome, urethral stenosis, lower urinary tract symptoms. In this study, the authors concluded that the diagnosis is mainly based upon symptoms, and investigations are aimed to exclude other conditions affecting the lower urinary tract. Various modalities of treatment, including antibiotics, alpha blockers, acupuncture, and laser therapy, have been proved successful. This management of these conditions, of course, is a multidisciplinary management, and treatment still is by trial and error. But the bottom line here is that they do include laser therapy as part of the treatment regimen. Now we're going to move into the final condition, second last condition, which is prostatitis. Once again, I've heard quite a bit of anecdotal information. Not a lot of studies. There are some studies out there, but good anecdotal information, meaning good results using the laser. Once again, it has to be within your scope of practice, and obviously you have to be trained in how to treat properly, but we have spoken to practitioners that are using the Theralase to treat this condition. So what are the laser effects on the prostate or prostatitis? Once again, anti-inflammatory effects, anti-pain effects, and also enhancing the immune response, which can also help with anti-inflammation. The Theralase treatments that are being used are 75 milliwatt power for 3 minutes per point using the multi-probe. And obviously we're doing external treatments. Here's a study where they looked at low-level laser therapy of male genital tract chronic inflammations. It's fairly old, 1998, and it's from the World Association of Laser Therapy Second Congress. So this was a paper that they discussed at this Congress. The objectives were that the authors aimed to study the role and parameters of laser therapy in the complex treatment of patients with male genital tract chronic inflammations caused by some STDs. Here they looked at 78 patients that were suffering from male genital tract chronic inflammations, and these were various inflammations. Prostatitis was just one of the conditions, but it also included urethritis, vesiculitis, different inflammations in that area. And the patients were divided into two groups. The first group was a medical treated group, so just using medications. And the other group was a laser treated group plus medication. So with the laser treated group, they treated them in a whole variety of ways using different lasers and different approaches. So this was fairly interesting. The patients had 10 to 12 laser treatments, so not too many treatments, but at least 3 or 4 of them were intravenous laser irradiation of the blood, which we do not do with our Theralase, but it is an approach. And 7 to 8 of the procedures were laser irradiation of skin projections of the male genitals and inguinal area, and also transrectal irradiation of the prostate gland. So transrectal meaning they were actually had a probe where they can put into the rectal area and try to get the light into their prostate that way. Obviously, it's a very hard area to reach with light, so they went at this from a few different approaches. The lasers they used were as follows. They used a Hemi laser, 632 nanometer, 2 milliwatt, at the end of a light guide inserted into a vein. They used a pulsed infrared laser cluster probe, also 890 nanometer with 12 lasers on it, and that was used for irradiation of skin projections, so externally. Next, they used a pulsed infrared diode laser probe, 890 nanometer, and this was the one that they used internally transrectally. And they also used medication as well, so it was laser plus medication. Overall, the group 2 results, or the laser plus medical treatment group, found a faster resolution of their symptoms. The lab investigation reports had greater improvements. They found things like improved sperm count and motility, a lower relapse rate, and they did not come up with any side effects or complications. So they found very positive results treating these types of conditions using the laser, and it was a fairly good sample size. They had well over 70 patients involved. Their conclusions were that the combination of medical therapy and laser therapy provides better and faster resolution of symptoms and normalization in results of their examinations. The authors discussed what they thought were the reasons that the laser was working in these patients. And these are theories. Please keep in mind these are theories, and in different studies that's what they're trying to do. They have a theory or a hypothesis and they're trying to prove this. But in the authors' discussion, they stated that laser therapy is a tool in the complex treatment of male genital tract chronic inflammations. Their study supported the opinion that the acceleration of treatment was mostly the result of activation of the immune system and increase in concentration of antibiotics in target organs. So their theory was that the reason the laser worked in these conditions was that the laser was very helpful in increasing the immune response and kind of fighting off these conditions. But also, when they used the laser with the medication, that the medication actually worked better when it was used in conjunction with the laser, that it increased the concentration of these medications in the target organs. So this is really interesting. I haven't seen this a lot, but it's an interesting hypothesis, and we might end up seeing many, many more studies on this. Finally, we're going to move into bronchial conditions and asthma. And why might we use laser on these types of conditions? I get a lot of questions about this. Can I treat all kinds of various conditions? And sometimes I've had certain questions about more asthmatic conditions. And the reason why it might work, although we don't see a lot of studies in the area, is that the laser therapy can relax muscles, so may relax the airway smooth muscles. Also, if the lung tissue is damaged or any of the bronchial tissue is damaged, we can restore healthy tissue and decrease inflammation. So there's lots of reasons why, hypothetically, the laser should really work in these conditions. The information we're lacking is more on dosing, wavelength, and what would be the optimal settings for these conditions. Here's a study called the Outpatient Use of Laser Therapy in Bronchial Asthma. The authors' objectives were to analyze effects of outpatient laser therapy on the course of different forms of bronchial asthma. This was a large study. They looked at 466 patients with bronchial asthma and divided them into 3 different groups. The first group was the laser-treated group. Second group was laser plus conventional drug therapy, and third group was just the drug therapy. And here were their general results. In the laser-treated group, and the laser plus drug therapy, they found quite positive results. They found that the asthmatic attacks were less frequent and less severe. They found that the patient's sensitivity to medications was enhanced, that the medications started to work a lot better. And also their corticosteroid doses came down, their hospital stays decreased, and disability duration decreased. So they saw a lot of positive benefits in using the laser or laser plus medication. 50% of patients from these two groups achieved remission within a 1-year period. And 40% of the from these two groups were in remission for up to 2 years after. So once again, quite positive results. What I'm missing and what they didn't include in this study were their exact treatment specifications in terms of wavelength, number of treatments, frequency of treatments, type of laser. And we do see this in some studies that they're not very good at giving all this detailed information, which would be very helpful. So hopefully in future studies in this area we'll see a little more of that information being given out. Their conclusion was the addition of laser therapy improves a bronchial asthma course, results of outpatient treatment and rehab, recovers bronchial sensitivity to medications, reduce their duration of hospital stay and disability. Generally, they had quite good results. Here's our last study here. They looked at laser biostimulation in the treatment of pleurisy. This was a prospective study to analyze the effect of laser biostimulation in pleurisy. And here's an x-ray showing a lung with pleurisy. This was after the patient had a pneumonia and they ended up with this pleurisy. The methods for this study were that there were two groups, a laser group and a control group. The laser group was treated with laser, actually over acupuncture points, and also just generally over the local region for 10 days. They also received conservative care. The control group only had conservative care. The researchers looked for changes in clinical signs, symptoms, x-rays, and they looked at some of the biochemical parameters. And they had fairly good results as well. The laser group had faster resorption of the pleural effusion, so they healed quite a bit faster. They had fewer pleural adhesions, decrease in clinical symptoms, particularly pain. They also had a significant decrease in the inflammation markers in the blood, so they would check their blood for signs of inflammation. And their results were, or their conclusions were, in patients with pleurisy, laser treatment increases regenerative mechanism of the pleural surface, so the lung tissue was regenerating and becoming healthier, thus decreasing the quantity of adhesions and resulting in better mobility of the diaphragm. So generally very good results in these patients. However, we need many more studies. We don't really have all the information to go ahead with these types of treatments, but this is a good start and shows you kind of where the research is going. Okay, sorry, one more here. In the same area, low-level laser therapy partially restores trachea muscle relaxation response in rats with tumor necrosis factors. So here we're looking at the effect of laser therapy on smooth airway muscle dysfunction. So they took rats and they dissected out the tracheas. And what they did is they bathed them in a solution that induced inflammation. So basically they induced inflammation in these trachea of rats, and they split the tracheas into two groups, a laser group and a control group. The laser group was treated with a wavelength of 655 nanometer, a dose of 2.6 joules per centimeter squared, plus they were given a vasodilator medication. The control group only had the vasodilator. And they also had very positive results. This is not a human study, but still it gives us information, gives us some good results. And they found that the muscle tension was reduced by 47% in the laser group compared to only 22% in the control group. Their conclusions were that low-level laser therapy partially restores the normal muscle relaxation response in inflamed tracheal smooth muscle. So this is another application where we really might see more and more research and potential treatments by using laser therapy for airway obstruction, for asthma, and bronchial conditions. So it's kind of an exciting area of research. So I hope today what I've done is enlighten you in terms of some of the areas or emerging areas of research using laser therapy for medical conditions. Of course, some of these areas we aren't currently actually using our laser to treat, but some of them you really can be treating right now. For example, the area of lymphedema, which we know it's been quite successful using laser therapy to treat that area. So if you have any questions, please feel free to email me directly at rmoston@theralays.com. rmostyn@thyroids.com. You can also find my email address by visiting our website, www.thyroids.com, and clicking on Ask Our Expert. We will have many new exciting events in 2011, and I hope you'll visit our website, www.thyroids.com. We will have our calendar events posted soon, and they will include monthly webinars and also a seminar series throughout Canada and the States, which will also be taking place on a monthly basis. I often get requests for copies of our webinar, and we do send these out automatically. And the way you can receive your copy is completing and returning the feedback questionnaire that will be coming to you in the next couple days by emailing that back. Once we get that back, we automatically send you off a PDF copy of the webinar. Also, we do record all of our webinars, so if you want to review the recorded version of this webinar, it will be posted to our website under Recorded Webinars, and you're welcome to listen to that at any time. It should be posted there within the next week. Thank you very much for attending this webinar, and I want to wish you all a safe, healthy, and happy New Year.